Hello, I'm Dr. Christopher Gay. I'm back with another installment in our series on different painful conditions. Today, we want to talk about herniated discs and sciatica. What is a herniated disc? In your back, you have bones at each level, and in between each bone is kind of a shock absorber called a disc. That disc has some squishy material in the center, some more firm outer covering, and at times, that squishy material pushes either through the outer covering, we call that an annular tear, but sometimes it just makes the outer covering bulge out and it touches stuff that it shouldn't touch. And when it gets large enough, we call it a disc herniation. Approximately 2% of the population will experience these. And one of the reasons they know they have it is they start to have pain, not only in the back, but they have pain shooting down the leg. We often refer to that as sciatica. Now, why does the pain shoot down the leg? When that bulge happens, if it's large enough, it actually presses on the nerves that are passing through the back, and they get irritated. And they start to swell, and they get less space, and they become more irritated. Once that nerve is getting pressed, it's just as if you leave your arm sitting somewhere for too long, or you sit down on a hard surface for too long. You may start to develop numbness, tingling. The signals going through the nerves that make them work sometimes can be interrupted, and you start to feel weakness in the legs. And of course, pain is one of the most common factors that bring people in to see us. Again, this pain can go all the way down the leg into the foot. It doesn't have to go the whole distance. You can feel it just in the foot. You can just feel it in the upper leg or any combination thereof. Unfortunately, many times the body doesn't read the textbook and it shows up however it wants to show up. And so those symptoms that you feel are following that nerve or nerves as they travel down the leg. And so it becomes important where you feel your pain. So we might say, do you feel it in the front or do you feel it in the back? That gives us a sense of which nerve or nerves might be involved and allows us to direct treatment. Of course, before getting into any treatment, we're going to find out more things about what's going on in your back. So we want to do some diagnostic tests, MRIs, and some physical exam tests to try to tease this out. So what can we do about it? We have non-surgical treatments for this, and those include rest, pain, physical therapy, and injections such as epidural steroid injections. Essentially, what these are injections of very strong anti-inflammatory medications. They calm down that irritation of that nerve, allows the nerve to shrink back to its normal size. When combined with physical therapy, often that nerve does not get irritated again for a long time, and you can go back to living your life. At times, the body doesn't respond to these things, which we call conservative measures. So when you fail those conservative measures, we start looking at surgery. Surgery is going to be considered if your symptoms persist, despite all of that, or if the nerve compression is severe to the point where you can't use your leg, or you start to have other reductions in normal body functions. So weakness, at times it can control or affect your ability to hold in or your urine or your bowel movements. And those things we consider surgical emergencies. So you want to go to the emergency room if you have sudden onset of those types of symptoms to be evaluated. If you're having pain and any other conditions, certainly make an appointment to come see us so we can get you back to living your life. Thank you.